Okay, so I'll start from the beginning. Jai Jirendra, good morning. Jai Shri Krishna. Uh, Today, my name is Dr. Rajesh Patel, and I was a family practitioner until retired and practiced for 42 years in Bronx in a primary care setting. Uh, so I have experience of treating thousands of people with diabetes. That's a topic for today. And it says science has progressed, the send man to moon, Mars, the vehicle to Mars, but human being hasn't conquered a disease called diabetes, and there is no cure yet found for diabetes. But it's up to us to control what we have. So, just give you a brief background. The diabetes mellitus, the word diabetes mellitus was in existence since 5th century BC. Our Indian doctor Susustra, he called the disease called Madhumaha. Madhumeha is called honey in the urine. And the diabetes word is derived, mellitus is derived from Greek and Latin word. The Greek word diabenin means a filter or siphon, and mellitus means sweet. Okay. Um, so diabetes is, as I said, affecting millions of people around the world, and especially in Indian community. Once upon a time was called Raj Rog because it was used to be more prevalent in rich people. So you should be happy that when you have diabetes, you are rich. But it's up to you to conserve their wealth and to take care of your body and conserve your health. And so now, what are the things when you, what is the, how is the cause of diabetes? The diabetes, I will first start with, there are two types of diabetes. One is called type 1 diabetes, which is called juvenile diabetes. And the other one is called type 2 diabetes or adult onset diabetes. And juvenile diabetes is a different type of pathology, why it happens. And I'm not going to talk about juvenile diabetes because it happens in younger population as a different type of treatment. So, and all of us are not juvenile as of now. I'm pretty sure they have a juvenile mind, but not juvenile body. So, so we'll talk about type 2 diabetes. Type 2 diabetes is, the cause of diabetes is called multifactorial and on genes, and it is dependent on your inheritance or genes, and as more predominance on genes. And one thing in this life, yes, you cannot choose your parents. So if you get the genes inherited, you have to accept it. Second thing is the obesity or overweight or overeating. It can lead to, or it can worsen your diabetes. And lifestyle is also important, how you live the life. And sedentary lifestyle is more likely to lead to diabetes. And so we start with, another thing is people who has a diabetes, women who have diabetes during pregnancy should be careful because they are more likely to do diabetes in the future. And a baby and a woman who gives a birth to a child more than 8.5 pound child is more likely to get diabetes in the future. So now, what are the things that, how one will find out that he has diabetes? The classical symptom of diabetes was called polyuria, polydipsia, and poly poly uh, polyphagia. So it's called polydipsia, means you get a lot of thirst. Polyuria means you make a lot of urine. Polyphagia means your appetite becomes more. So if you have these three kinds of symptoms, you have 90% chance to have diabetes. And very thing, if it happens, very important thing is to go and see a doctor. So when you go and see a doctor, what are the minimal tests the doctor is going to do? First is take the blood and the urine. And in the blood, they will check your sugar level. They will do another test called glycosylated hemoglobin, called hemoglobin A1C, and check the urine for any leakage of protein in the urine. So now once you find out you have diabetes, do not get dissipated. It's up to you to control it. You will never be able to cure it, but it's up to you to control it. The most important thing for the doctor is you have to choose the right doctor, first of all, to make sure that he takes care of you and he listens to you. And it's your also duty to go to the doctor and do a checkup. And I would say in this society, you have to teach the doctor also, because you have to educate yourself. And if you don't educate yourself, you probably will not get the right kind of treatment. So general knowledge about diabetes and what to expect is very important. And it's, first is you have to start with anything is diet and exercise and check your weight. And the diet is says called you avoid simple sugar. Simple sugar means which will go into your bloodstream easily, like sugar, gold, and and sweet oil. It is more likely to go and raise your sugar immediately because it will get absorbed faster. So then you take complex carbohydrate. It is called yaourt, which has low glycemic index, because that food will not get digested quickly and will not raise your blood sugar immediately. Then you have to increase your intake of protein, decrease the intake of carbohydrate, fat. And you, if you have a facility available, you should consult a dietitian and go to the and consult the food accordingly. So my other thing is, what the doctor or you should do is check your hemoglobin A1C, and you should set a target. Whenever you go, anything you should have a target that what is my goal, and you have to try your level best to reach that goal. So the goal will be to have a glycosylated hemoglobin under 6.5. And if you can reach that goal, it's good. If you can't reach the goal, at least go up to 7. And my practice, or I say if you are 75 or 80, I would give you a grace of one more. So maybe 8 is acceptable when you are age 75 or 80. And so, and second thing is regular exercise, regular diet, and then there are a lot of medications that are available. I don't want to talk about medications because that's up to your doctor, and I'm not here to tell you which medicine to take. But the simple thing is take a medication which are least likely to cause side effect, and which is basic, which is not going to control your diabetes very well. It's a very common medication everybody knows. Previously, many years ago, they used to give you a class of medication called sulfonylurea. And that medicine is an obsolete now. Now there's the second gold standard medicine is called metformin or bigunite class of medicine. And that most of us with diabetes will be probably on metformin. And Some people cannot tolerate metformin because they get stomach upset, and the doctor has to choose a different kind of medication. And I will not go into details of the medication because it's up to individual person. But then the last stop is then you start intermediate. There are injections available, and there are different types of insulin available. And then the last stop, there is a called insulin pump also, which is available. So there are so many options available, and it's up to each individual person to choose that option. Now, the most important thing is diabetes is a disease of multiple systems. It affects each and every part of your body. And so up to us to control the complication of diabetes. That's the most important thing. There are basically two types of complication. One is called microvascular complication, which means it affects smaller blood vessels called microvascular blood vessels in the body, and the second is called macrovascular complication, called bigger blood vessels in the body. In the microvascular complication, the main thing is called eye in the retina, which causes diabetic retinopathy, and then it affects the kidney, the blood vessels of the kidney, and is called diabetic nephropathy. And it is one of the most leading cause of kidney failure, and people on dialysis, a lot of people because of diabetes. And the third microvascular is called diabetic neuropathy, which affects the nervous system in the body. And what you have to look out for is when you get tingling and numbness in the feet when you have diabetes, chances that you have a nervous system called diabetic neuropathy. And kidney will slowly, the doctor will check your kidney, and a blood test called BUN, creatinine, and a microalbumin in the urine. It will be checked by the doctor, and they will have to progress what the disease, how the diabetes is affecting the kidneys. The macrovascular complication, which is very important, it affects the larger blood vessels in the body, and it causes a thing called atherosclerosis, as causing the artery of the heart to get blocked, and it causes coronary vascular disease, and affecting the bigger blood vessels in the head called carotid artery, and it could lead to stroke. And the other thing is affecting the larger blood vessels of the leg, and which causes the circulation in the leg and can cause gangrene. And so these are the things that you have to look out for. You take your medications regularly, go to your doctor regularly, and get your system in order and look for the complications. And the thing is to check your heart, go to a cardiologist. Once you have diabetes, should definitely go to a cardiologist at least once a year, check your heart. Then to check for circulation, there is a test called Doppler study that you can do to find out the circulation of the leg. To check for the circulation in the brain, there is a test called carotid Doppler, where they do check to find out how the carotid artery, the blood circulation to the brain is, how much it is affected by this. And then what the diabetes, people who has diabetes has to do is make your weight control. And also anybody with diabetes should be on a medication called cholesterol medicine. And if your doctor has not put you on cholesterol medicine, then you should insist that you should be on a medicine of cholesterol. The common one is called Lipitor, called Atrovestin, and the other one is called Rosuvastatin, called Crestor. These are the two most common medications that are available that you should be on. And there's another medicine called simvastatin that maybe you should avoid it. And The other thing is you have to check your kidneys, and there's another medicine called ACE inhibitor class of medicine, and every patient with diabetes should be on that medicine if possible. If you can tolerate that medicine, and baby aspirin every day, you should take a baby aspirin every day. And uh, and that's in brief about diabetes that one person should do. Check, take care of your circulation in the leg, and make sure you are more prone to get infection. So you should increase your immunity by doing yoga, eating the right food. And if you take care of your body, and God will help you and to take care of your diabetes. So basically, this is in a brief nutshell about diabetes. I'm going to talk about, I don't have a time to talk about the heart problem and circulation and cardiac, that I will probably give a second talk about it. But basically, that it is up to you to take care of your body. And if you have a healthy body, you will have a healthy mind and healthy lifestyle. So that is basically in nutshell. Uh, I don't want. I'm not a replacement for your doctor, but you should see your doctor on a regular basis and take care of yourself. And that's about it for today in nutshell. And if you have any other questions, anybody has any questions, they can either talk to me later on, or I'm going to have a second session about blood pressure and other things that people can do to take care of it. Okay?